Okay, it's 10 o'clock Eastern Standard Time. We might make a start. Good morning, my name is Rachel Morton and I'm a Professor of Health Economics at the University of Sydney and President of the Health Services Research Association of Australia and New Zealand. Welcome to the HSRAN's monthly webinar. This webinar this year is organised by Sundreesen Naker and Michelle Allen from OSHI, who are one of our partner members. Before we get underway, I'd like to acknowledge the traditional owners of the lands on which we meet. For me, based in Sydney, that's the people of the Eora Nation, and pay my respects to elders past, present and emerging. The Health Services Research Association of Australia and New Zealand, or HSRANS, is the peak professional body for multiple disciplines that are doing, funding and using health services research. And the health services research is done to improve policy and health systems, to improve healthcare and delivery for the citizens of our countries. Our flagship event that you may be aware of is the Biennial Conference, and this year it's in Sydney from the 1st to the 3rd of December. And we encourage you to register and attend this unique event. For the webinar today, how it works, our presenter is going to talk for about 30 minutes and then we'll have time for discussion. We encourage you to post your questions in the Q&A section at the bottom of your Zoom screen. Please post questions there rather than the chat, because the chat can be a little bit distracting for our presenters. And then we'll have 15 to 20 minutes of discussion guided by your Q&A. Okay, our webinar presenter today is Yaru Woman of Broome. She's an early career researcher and Scientia lecturer at the Centre of Big Data Research in Health at UNSW. She's an epidemiologist with research interests in health disparities and the quality and governance of Aboriginal and Torres Strait Islander data. Please welcome Dr. Kalinda Griffiths, who will be presenting on identifying Aboriginal and Torres Strait Islander people in official statistics and other data towards equity in health. Thank you.
Thanks, Rachel. And thanks for the invitation to come and have a chat with you all. It is a privilege to be talking to you about a topic that I think is of such importance and one that has tangible life impacts in the health and well-being of Aboriginal and Torres Strait Islander peoples. Before we begin, I would like to acknowledge the traditional custodians of the many lands on which we're meeting here today, and particularly the Larrakia people on whose sovereign lands that Darwin was founded, unceded, where I'm calling in from today. I'd like to pay my respects to all elders, those the past, the present and the future. And I would also like to acknowledge other Aboriginal and Torres Strait Islander peoples and Indigenous peoples who are online today. So Nayu Nelawa Kalinda Griffiths, Nelawa Corpus, Nayu Jandu Jandu Buru. My name is Kalinda Griffiths, my family name is Corpus, and I am a proud Yaru woman. My country is in Broome in Western Australia, and my interest is in the usability of existing data and big linkage data for the purposes of research to better understand why some populations are healthier than others, and also to support community development. And everyone here today would have some understanding of the importance and the important role that data plays in identifying how health systems and health services work for particular population groups. So what we're going to do here today is have a bit of a conceptual talk and contextualise data for research and research reporting purposes. And I'll highlight some of the critical discussions that are required when we talk about Aboriginal and Torres Strait Islander people in official statistics and data collections, as well as some of the considerations in the data governance within this context. Hopefully this will be useful for people in terms of ideas and strategies for research, as well as with services with Indigenous peoples and communities into the future. Some of you may have heard parts of this talk before, and for those who have, I do hope that new insights are seen because it is a bit heavy at times. I do want to preface a couple of things. Firstly, that I use the term disparity purposefully, and I use it because it highlights an implicit assumption that the differences we see between populations can be due to social injustices, so an inequity, and not simply a variation in equivalence between two groups, so inequality. And this is an important term because it describes embedded systemic issues in society, as well as those things that we cannot accurately measure, so something like colonisation. I also use the terms Aboriginal and Torres Strait Islander people and Indigenous peoples throughout this talk, and I primarily use the term Indigenous peoples in an international context. So full disclosure, I really love data, and I love it because it holds power. It has this power to tell particular stories about the world around us. In health services, as an example, it tells us about who's accessing services, for what, and when along the health and disease continuum we see them, and for how long we see them in these services for. And look, we're in the data era, and we know that data is important for understanding distributions of health and wellbeing within the nation. So whether this is mapping those healthcare services, identifying or improving screening outcomes, or even utilising community level data to report on community priorities in regards to health, data plays a massive role in our understanding of health and society more generally. But the picture is expansive and it's dynamic, and we know that data is growing exponentially every day. And while data has this incredible potential, there are a range of considerations and gaps regarding data and data use when working within the Indigenous context. So in 2019, a group of us published a review on Aboriginal and Torres Strait Islander identification, and this was recognising that identification is the central issue to the data collected about Indigenous peoples around the globe. It was one of 9 articles from 5 nations discussing the identification of Indigenous peoples in their respective countries. And the countries included Australia, New Zealand, Canada, the United States and Brazil. And it arose from a number of global meetings over the past several years with members from the International Group for Indigenous Health Measurement. And it also included people working within official statistics, governments and international agencies. And importantly, previous meetings on how to best measure Indigenous health, specifically the impact of colonisation upon health, highlighted this known invisibility of Indigenous peoples in official data collections, the result of which placed an advocated call to international and national statistical agencies to actually improve these global efforts in the collection of Indigenous data. And this raised further discussion about how Indigenous peoples are counted and by whom, how human rights are met with regards to the right to be counted as Indigenous peoples, as well as highlighting the quality of the information used to report on Indigenous peoples. So we thought it was also important to describe some of these critical issues arising when we talk about Indigenous peoples and official statistics, and also stuff that's important for Australia to consider. So this includes who is counted, which includes considerations around definitions of Indigenous peoples and the operationalisation of those definitions, as well as the propensity to identify. Secondly, how many people are counted? And this includes issues of completeness of the coverage, of the accuracy of the count, as well as methodologies used by national statistical agencies to address issues of over and under counts. And also what is counted and measured, which involves the development of indicators and measures that encompass Indigenous people's state of values, state of events, their values and their understandings. And I guess to start this off is about a conversation about the context of Indigenous data. And this is often a conversation that's a little bit challenging to have, but at the core, it's better to understand some of these issues. And so most official data collected by governments on Indigenous peoples is developed within a colonial and racialised context. And what this has resulted in is what we call coloniser-sanctioned forms of recognition. What do I mean by this? Well, while the recognition of identity, so who we are, can be achieved by Indigenous peoples for Indigenous peoples, we actually need to be cognizant that the recognition of indigeneity within data has historically only been granted by governments. So as an example, the Australian government officially counted Aboriginal and Torres Strait Islander people from 1901 to 1967 for the sole purpose of excluding us from the national population count. In 1967, Australia had a referendum, And this resulted in changes to sections 51 and 127 of the Constitution. And it was the change to section 127 that resulted in the inclusion of Aboriginal and Torres Strait Islander people in the census. And this inclusion only arose from the nation's moral imperative to include and count Aboriginal and Torres Strait Islander people via a democratic vote. And further, it wasn't until 1978 that the Commonwealth definition of Aboriginal and Torres Strait Islander people was developed. And again, it wasn't until 1996 that the operationalisation of that definition, the standard Indigenous question, was officially implemented. So our starting position with data is within this paternalistic power differential. Basically, we were allowed to be counted. So people have the right to recognition, people have the right to be counted. And when it comes to data and official statistics, individual and collective rights to citizenship in Australia can only be met with accurate identification and accurate counts in the data collected about us. Recognition is embedded in our right to self-determination. And there are a couple of critical articles within the UN's Declaration on the Rights of Indigenous Peoples, as well as other human rights mechanisms as well, that provides a kind of blueprint for nations to discuss and incorporate Indigenous peoples' rights in the discussion of data and information collection. The first is regarding the right to identify, where Article 33 states that Indigenous peoples have the right to determine their own identity or membership in accordance with their customs and traditions. And it's clear that Article 33 highlights the requirement for self-determination in identification. It should also be noted that it purposefully does not specify a definition of Indigenous peoples. Article 15 states that Indigenous peoples have the right to the dignity and diversity of their cultures, traditions, histories and aspirations, which shall be appropriately reflected in education and public information. So this, along with the right to identify as Indigenous and our right to self-determination, actually provides a framework to guide what information is collected about us and for what purposes. In regards to managing expectations about what happens with that data, Indigenous data governance approaches underpinned by community-led Indigenous data sovereignty principles can be developed in programs and systems that collect information about us within our respective nations. And this is what people term as the democratisation of data. So if data is to be used to tell our stories, our experiences, and we're going to be reported on, then we need to be at the table and we need to know that we have every right to do so. So I guess the question is how do we reconcile the hegemonic issues with data and the needs and aspirations of Indigenous peoples? Well, I don't exactly know, but the starting point is embedded in human rights and Indigenous data sovereignty and Indigenous data governance and the application of those human rights. And we also need to talk about them more. Like I said, data can be incredibly powerful. It can be powerful for governments and it can be powerful for Indigenous communities. So what is Indigenous data sovereignty? And no doubt you've heard the term and you're probably hearing it more frequently these days. But before we define it though, this is a timeline that we've developed from a review that we did on Indigenous data sovereignty in Australia. And we found that there are a number of principles, issues and needs specific to Aboriginal and Torres Strait Islander people in data that had been explicitly described since back in 2004. And so this timeline is specific to Australia. And I would like to point out here that in 2016, the ANU Australian National Centre for Indigenous Genomics statute was actually enacted as law. And the document requires that all samples held as part of a historical research program be overseen by Indigenous governance. And I think that this is a kind of a good template and a feed of self-determination around data governance. And I highly recommend that people read it if they can and they're interested in how to best go about doing this work. So I'm a quantitative researcher and I've worked with others to apply these practical approaches to governance of Indigenous data for the past 15 years. However, it was only about 5 years ago that the first international meeting on Indigenous data sovereignty convened. And so while the Indigenous data sovereignty literature and language has been developing very quickly over the past 5 years, for those of us who have worked with large population data assets for a while now, we've been having these discussions for much longer than that. So Indigenous data sovereignty has been defined by Kukatai and Taylor as the inherent and inalienable rights and interests of Indigenous peoples relating to the collection, ownership and application of data and information about their people, their lifeways and their territories. And we now know that when we work with data, there are a complex array of factors and multiple sectors that contribute to data collection and reporting. And Indigenous data sovereignty is the way to assert self-determination in the way in which we develop, control, maintain, protect, and use our data. It should be noted, however, that Indigenous data sovereignty is a conceptual term and theoretical by default, and it's applied through Indigenous data governance processes. So if data sovereignty generally is about managing information in the way that is consistent with the laws, the practices, the customs of the nation state in which it's located, then where do these inherent and inalienable rights and interests of Indigenous peoples fit? Well, the power differential that I spoke about earlier has resulted in limited structures that support Indigenous worldviews, values, and understandings within societies. For me, I see that now is the time for valorisation, and that is normalising value to support Indigenous worldviews, practices, and understandings within Western structures, legal and regulatory frameworks that will facilitate ensuring the rights and interests of Indigenous peoples are met. So basically, Indigenous data governance that provides for collective representation of the needs of individuals and communities. So data is incredibly powerful and it's incredibly important in regards to the reporting and the provision of services for our mob. And data is used to describe and monitor the social, economic, health and wellbeing of Aboriginal and Torres Strait Islander people just generally in Australia. And this reporting occurs, I guess, not just in Australia, internationally, nationally, across state and territory jurisdictions as well, but it also occurs at a community level. And data and information derived about data about us, it actually matters. And in fact, in Australia, it mattered so much that the Commonwealth Bureau of Census and Statistics, which is now the Australian Bureau of Statistics, and its subsequent Legislation Act, was developed less than 5 years after Federation. And this meant that the federal government prioritised the collection of data and information for the development of an independent regulatory body. So again, data holds power, and data matters because it tells us who needs what where. But data matters differently to different people. And for me, it matters because if we aren't counted in the data, then we effectively don't exist. Our official reporting includes meeting requirements on existing agreements with the OECD, with the United Nations. We've also got the National Indigenous Reform Agreement and the new National Agreement on Closing the Gap, so the Closing the Gap targets, as well as a range of state and territory policies and frameworks. But the enumeration, the counts of Aboriginal and Torres Strait Islander people isn't just necessary for reporting, it's also necessary for the allocation of population level funding and individual services. So, for example, the Commonwealth Grants Commission, this is the commission that allocates goods and services tax, uses measures of population growth, including intercentral differences based on ABS estimates of populations to allocate funds across different regions. So the table here shows that there was a 14% census difference from the 2011 to the 2016 census, the impact of which we're yet to learn more about. But if history repeats itself, then this could mean that out of regional and remote areas actually miss out on funding. And this has happened in the past. And further, the Australian government requires that Aboriginal and Torres Strait Islander people need to identify themselves as such to receive Aboriginal and Torres Strait Islander specific services and programs. And this is all overarched by the fact that Indigenous peoples have the right to be counted. Data plays an important role because Indigenous peoples have health, economic, social, environmental and cultural rights that cannot be wholly addressed if there's missing information and large inaccuracies in this reporting. So this is a graph that shows the differences in mortality rates between Aboriginal and Torres Strait Islander people and non-Aboriginal people from the 2020 Closing the Gap report. And the report commentary to this graph stated that there is significant decline in mortality rates from 2006. Now, this data trend statement is a concern because it relies on the initial years of decline from about 2006 to 2009. Everyone who has ever played with Aboriginal and Torres Strait Islander data knows that the quality of mortality data has quite a few issues up until about 2010. My point is this, is that methods matter. If we think about this in absolute terms, then the gap isn't closing. In fact, it appears to be getting wider. And we need a reality check when it comes to reporting processes. And if there are disparities, then so be it. It means that we need to work towards solutions instead of denying that the issue exists or trying to reframe it as a potential closing. I want to note that the 2021 Closing the Gap report, the age standardised mortality rates were actually not presented. And instead a comment on child and infant mortality rates and a graph on age standardised avoidable mortality rates were shown. So as a quick example of issues with undercounts, this is the birth registration example. Aboriginal and Torres Strait Islander births within a large number of states and territories are actually critically underreported. And we know that there are a large number of births missing from official statistics used for reporting purposes. To identify the issue of birth registration underestimation, two data sets are usually looked at. One is the perinatal data collection, and this holds information about obstetrics, delivery, perinatal outcomes. And this data is collected in each state and territory from midwives and other staff who use information collected from mothers and hospital records. The second is the birth registration data collection. And this is the information given to state or territory registrars of births, deaths and marriages, usually by the parents after birth. So the data captured by registries can vary by state to state as well. And this can also impact consistency in terms of national reporting. Nationally, we know that there's almost 5% of under-registration of births across the entire population when linked when we link the birth registration data to the perinatal data collection. However, when this is looked at by Aboriginal status, this rate increases to 17% and under 18% under registration in Queensland and Western Australia, respectively. Furthermore, if this is looked at by remoteness, the proportion of under registration of Aboriginal and Torres Strait Islander babies in remote and very remote areas is up to 23.4% and 27% for Queensland and Western Australia. These estimates of under-registration show that 1 out of every 4 Aboriginal and Torres Strait Islander babies and babies born in remote areas don't actually exist. Well, what does this mean? It means that anyone using the birth registration for the purposes of official statistics reporting would get it wrong. It's also why there have been different statistical methodologies used when Aboriginal and Torres Strait Islander birth registration data should be used for things like life expectancy estimates. It basically complicates things more, and using things like backcasting enhancement of life expectancy estimates through census data as an example. So what do we do about it? Well, birth registrations enable the rights to citizenship to be enacted. Everything from a Medicare card to a passport is the result of having our birth registered. And this requires working with registrars and state and territory jurisdictions to ensure that all of our babies are counted. In terms of official statistics, the good news is that with the move towards data sharing within governments, we'll be able to pick up those people who access services through data linkage. So as an example, a baby may not be registered at birth, but may be picked up by a GP, or maybe picked up by GP data or education data. And this data could theoretically then be used to enhance birth registration data and flag those people who require registration to ensure birth certification. But it isn't just about handing over information about us. It's about ensuring that governments and official statistical agencies can actually work for us. There is real potential to use Indigenous data governance in reforming data systems to drive Indigenous agendas. When it comes to data for real change, we have Indigenous leadership and community identified priorities. I guess having those needs and aspirations and strategic partnerships assist is the way forward. The work of the Indigenous Data Network at the University of Melbourne reflects this, and there have been a few research programs that have been doing this without actually putting a name to it. So I guess a successful example of the power of using data to prioritise our needs is work arising from the broad international and national partnerships through Menzies School of Health Research Cancer Team. And this is headed by Professors Gail Garvey and Joan Cunningham. And this has resulted in implementing policy changes that aims to improve national services and systems for Aboriginal and Torres Strait Islander people with cancer. When I first started in cancer epidemiology a little over 10 years ago, we didn't even have national cancer estimates for Aboriginal and Torres Strait Islander people, an important gap in the data of now the biggest killer of our mob. And the first semi-national estimates for Aboriginal and Torres Strait Islander people were done back in 2010. And now there's ongoing national reporting, as well as a national framework to tackle cancer, and we can use data to monitor the impact of these implementations and our progress into the future. However, there are quite varied differences in whether data is being used for the priorities of governments, research, or for the priorities of Indigenous communities. And the question here is, who speaks on behalf of whom when it comes to data development and use? So pulling together some of the things I've mentioned here today, and we'll conceptualise it through this diagram. The recognition of Indigenous peoples requires the acknowledgement of Indigenous peoples, and also includes how Indigenous peoples are described and defined. And this should be in alignment with the UN Declaration of the Rights of Indigenous Peoples. And while Australia does pretty well relative to other nations in regards to data capture and recognition within systems, this is about systems and data supporting our right to self-determination and community advancement, which needs much more improvement. We also need to talk about operations. How do we best build data assets that reflect the aspirations of Aboriginal and Torres Strait Islander people and the capability of the next generation of Indigenous data nerds? Some of the work that we're doing with the Indigenous Data Network is about developing community-controlled data assets and building the technical capability of communities alongside governments. We also need to be recognising who is setting the priorities regarding data use to benefit the aspirations of Aboriginal and Torres Strait Islander people and communities. We need to always be asking the question, who are the we in this discussion? When it comes to population level data and decision making, who should be representing whom? I don't have the answers to these questions, but some of the work that we're currently doing will hopefully find the best ways of doing this into the future. And finally, we need to be focusing on monitoring. How are we doing? Where should we be focusing our resources? Again, it's dependent on who's doing the monitoring and where that information goes. And this determines the narrative, the stories that are being told about us. So it's important that we're also leading this. In order to answer some of the questions arising from these discussion points and develop an integrated framework that captures these issues, I'm currently leading a national collaborative program of work that will systematically develop national best practice guidelines or evidence-based recommendations for the use of Aboriginal and Torres Strait Islander data. And so if anyone is interested here today in assisting or working with us, please get in contact with me. And I want to finish by noting that this talk is specific to administrative data, which is one of my favourite types of data. And it is data that's overseen by regulatory bodies, it's overseen by legal frameworks and existing governance processes. And I haven't discussed digital data, metadata or AI potential in this talk, although similar considerations that have been raised here will actually apply. It is worth noting that there are limited regulatory and legal frameworks regarding these data in Australia, which raises further challenges in asserting data rights, not just for Aboriginal and Torres Strait Islander people, but for everyone. And I want to plant the seed to grow towards building capabilities in these sectors for anyone exploring this. To me, I see the data challenges, I guess, or the challenges in data use and data generally as complex, it's multifaceted, it's dynamic. And so I guess we need to be like water. We need to be a little bit adaptable to changes in the data landscape as they may arise. I think some of the answers lie in directing the conversation towards evidence-based Indigenous data governance. It's underpinned again by community-led Indigenous data sovereignty to ensure that there are mechanisms of voice for Indigenous people and communities in regards to how data is collected and used. We need to recognise that the work from previous Aboriginal and Torres Strait Islander leaders in fighting for our right to be counted in the data is very powerful, and we cannot diminish this. And if that we aren't counted, then we effectively don't exist in the eyes of government or within existing systems. Undertaking system reform in data use to embed Indigenous data governance requires us to kind of bust all of this open, to speak about it more, to break down the silos, to face some uncomfortable truths and to work together, I guess, learning from our past and into our future. And I will just leave it there, but I'd like to acknowledge all of the crew that I work quite closely with and who support what I do.
Excellent. Thank you very much, Kalinda. That was absolutely fantastic. We have now about 70 people online, so now's the time to put your questions into the Q&A box, and I will read them out so that Kalinda can respond to them. Yeah, terrific. So, gosh, I have lots of questions myself. I might just start with one fairly specific one about the reporting of age standardised mortality rates. And you mentioned that it was omitted from the previous report because of the concerns, I guess, about misrepresenting counts and misleading trends. So looking at that report, it looks to me like it's an issue with the denominator in terms of there hasn't been a very all-encompassing way of identifying Aboriginal and Torres Strait Islander peoples, and that therefore the trend is misleading because there have been changes in the way that over time, and you mentioned 2006 to 2009, changes in the way the counts are done, which makes longitudinal trends a little bit meaningless. Is one way forward in presenting this type of data a little bit like a Kaplan-Meier graph, where you have sort of at each time point, at each year, the number of the population, so that the known or identified number of Indigenous people at each year, and then you are really, adjusting for that changing denominator with all its limitations.
Yeah, I've never actually thought about using KM to present on it before, but yeah, theoretically, yeah, it could work. But ultimately, we know that from 2010 onwards, the data is pretty solid. There are some issues with it, but utilising anything prior to that date is going to be a bit fraught. You're going to find artefacts, and whatever your claims are around, I guess, the findings from that are a bit arbitrary. So yeah. I think, yeah, again, just going back to that date, 2010 is the date in terms of mortality data. And ultimately, yes, you could potentially enhance it, but even then still, when it comes to enhancement, we're using census data, we're also using hospitalizations. 2010, again, is the date. Census is a little bit different, but yeah, hospitalizations, 2010. So yeah, there are enhancement processes there that have worked, but that's the number, that's the data.
Sure. Okay, no, thank you for that. All right, we'll start with the first question from Lisa Sharwood. I'm just going to read it out because there's a nice message here as well. Hi, Kalinda, thanks so much for this presentation. I did attend also the workshop prior to the IPDLN on similar topic. And there was a call out for people interested in doing further work in the space of better identifying Indigenous people in our administrative data. To which I responded, but haven't heard anything about it. Are you aware if anything's happened as a result of this, or is the opportunity you just mentioned coming from that, and how does one get involved?
Yeah, so there's two things happening with that, Lisa, and thanks for that comment and the questions. So the IDPLN, we have developed up an international working group as a result of that workshop. We're still, I guess, getting that up and running. And there have been a couple of changes in-house. And also this year's been a bit fast-paced. So the moment that that's up, the IDPLN will obviously push that out. The second thing is the work that we've been doing, there's a couple of different programs. One is with the Lowacha Institute. And so we've developed up an evaluation toolkit that services, researchers and other organisations can use to make an assessment of how well they're going in terms of Indigenous data sovereignty processes in-house. Because I think that one of the biggest challenges that has occurred in regards to Indigenous data and particularly data governance is that people don't know exactly what they need to do. And so hopefully that will assist. That will be released in July. We're currently going through pilot testing and the prototype is out in the abyss and coming back with reviews. The other thing is around the Indigenous data governance best practice guidelines. And so that is, I think, the biggest piece of work, and it's taken a little while to get off the ground, but we have put in for funding through the ARC and several other groups, and we've got a bit of an A-team on that with Aboriginal leaders as well. And so as that starts to come about, we will begin to push that out. But if you want further details, please email me as well, and I can forward on kind of where that is up to. At the moment, we're running off the smell of an oily rag, but we're kind of getting a bit of momentum at the moment.
Okay, so that'd be great. If you could perhaps pass those details on to Sarah Green, and then we'd be able to distribute them to people who are participating in the webinar today. Thank you. Kalinda, the next question comes from Paul Lawton. Hello, Paul. There are others such as Chelsea Wadigo and or Summer May Finlay who suggest, or at least imply, that research that seeks to understand Aboriginal and or Torres Strait Islander perspectives must be conceived of, led and reported solely by Aboriginal and or Torres Strait Islander people. What's your view, Kalinda?
I think that it needs to be conceived of and led by Aboriginal and Torres Strait Islander people, definitely. I think that there's, a numbers issue here. So we're speaking about 3% of the population, and ultimately, when it comes to getting the work done, it means that we're going to have assistance in that process. The overarching, I guess, leadership needs to be Aboriginal and Torres Strait Islander people, because we can't have non-Aboriginal people telling us what we should be doing. And that's that continuation of that paternalism. We want to have, that space very clearly defined. I think, as we move forward, it's going to be a bit easier. These conversations have become a bit more frequent. And it isn't confronting or challenging by any terms. But again, it's about who makes decisions on behalf of whom. I'll always go back to that. We can't have non-Aboriginal people making decisions on behalf of Aboriginal people. That's a historic timeline. Sure. That's part of our past.
Great, thank you. The next question's from Imogen Page. Thank you very much for an interesting presentation, Dr. Kalinda. I just have a quick question regarding the census data. How are the percentage of undercounts determined?
They use a survey called the post-enumeration survey, which is sent out after. And basically they go around and it's like doing a double check. And I mean, I'm not an ABS official at all, but they do really well in terms of trying to capture the counts. And the pairs is, I think they've changed it now, but historically it was the pairs it gives us those numbers. Yeah, and basically they update the census data that you get online with those post-enumeration survey counts as well. So that fancy fandangled methodology that I was speaking about is part of that. So yeah, after they do that pairs, they use some awesome methods, and then they adapt the population counts based on it. Yeah.
Okay, great, thank you. Next question is from Deb Russell. Hi Kalinda, do you know why the percentage undercounts of Aboriginal and Torres Strait Islander people in censuses is increasing? For example, 7% in 1996 to 17.5% in 2016 is substantial. Sorry, say that one more time, Rachel. Do you know why the undercounts in the census are increasing from 7% in 1996 to 7.5% in 2016? It's just differences. I'm not entirely sure if that's an undercount. And so, yeah, that is, so changes in the census occurs for a variety of reasons. If you have a look at it by political status, you can kind of go, okay, well, who's in leadership at this point in time? And sometimes that impacts, if you're trying to get associations, sometimes that impacts people's willingness to identify within the census as well. You've got people who just don't have trust in the system. You've got people who are learning about the historical and I guess their lineage and their backgrounds as well. And so some people are newly identified Aboriginal and Torres Strait Islander people as well. And so everyone kind of fits in the same box, which is a bigger conversation to have, because there are some issues around that as well. But ultimately, yeah, when we're counting people in the census, it's going to depend on the day. It's going to depend on the trust in government. It's going to depend on, yeah, the willingness for people to identify. It's really important that people do. Ultimately, though, to have trust in the systems that have worked against Aboriginal and Torres Strait Islander people is a big ask. And ultimately, we don't have any formal structures or systems that can ensure that all of this data and information can be used for Aboriginal people by Aboriginal people as well. So there are some real challenges in what actually occurs once that counting happens. But again, it's really important that it does happen, because otherwise Aboriginal and Torres Strait Islander people miss out. So those counts, they vary depending at times, and there are a whole complex array that I've spoken about that play into reasons why people decide not to. Yeah. Or decide to. Yeah. Okay, terrific. Thank you. A few more questions. The next one's from Claire Zammit. Such an awesome talk, Kalinda. I'd like to know your perspective on hospital administrative data and reporting on Aboriginal and Torres Strait Islander identification and your comments for Indigenous data governance. How would you navigate the usage of this data that respects the principles of Indigenous data governance? This sounds like it might link into the next national best practice guidelines, possibly as well.
Yeah. Well, the first thing is around the collection of the data. Ask the question. So within hospitals, you know, part of the development of the standard Indigenous question and the operationalisation of that question was to make sure that people ask the question, don't make assumptions about someone walking in the door. And so that's the first part, making sure that, you know, hospital systems are in check enough to do the collection accurately. The second part is then about what's the data being used for. Again, it goes back to the points that were made by, Summer and Chelsea and Paul, putting that forward as a real, Aboriginal and Torres Strait Islander people should be at the forefront of those decision making around what happens within, if it's an individual hospital or whether it's within the national collection. And so all of the data from hospital admissions goes into the AHW, the Australian Institute of Health and Welfare. It goes through their clearinghouse, it does blah, 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 and it sits there for utilisation and national reporting. So I'm on the Aboriginal and Torres Strait Islander Statistical Working Group with the Australian Institute of Health and Welfare. But again, the governance process around that is as an advisory role. It's not as an embedded system. And so it means that at any point that advisory committee can be disbanded. And so ultimately what you want is structures that support Aboriginal and Torres Strait Islander people, not that it's necessarily tokenistic, but it definitely doesn't ensure that Aboriginal and Torres Strait Islander people will always have a voice in that process. So these systems need to be set up, and it's not just at that national level, but like I said, at that individual hospital level as well, to make sure that whatever's being used and how it's being used needs to be led by Aboriginal people.
Okay, thank you. And so another question, this one's from me with respect to specific data sets. You talked a little bit about hospital data. Are you involved with extracting or trawling through electronic medical records held at the hospital level, as well as state-based collections such as the admitted patient data collection, federal collections such as MBS and PBS, and what about imaging data, the CT scans, X-rays, skin imaging? Could you just respond to perhaps any, particular considerations about those different types of administrative data?
Yeah, the first thing that comes to mind when you're mentioning this is whether there is, government-funded supported administrative data. So, you're speaking about hospital admissions as an example, or Medicare, or PBS, all those guys are completely funded. Whereas you start to speak about radio imaging, or you start to speak about pathology forms, and suddenly you're into a world of private enterprise. And the moment that you start to hit into the world of private enterprise, there are a couple of things that happen, but the most challenging, I think, is around the non-inclusion of Indigenous identifiers. So that standard Indigenous question that I spoke about, that was developed back in '78, that, I think it was 1996 implementation. That implementation then went to every government department and every government data set and they said, you need to ask this question. This is how you do it. They didn't do that with private sector. So anything to do with radiology, anything to do with, pathology is a really big concern. The work of Lisa Wap, as an example, has been pushing forward for the identification of Indigenous peoples within pathology forms, because she doesn't know whether, those people who are being screened for cervical cancer are Aboriginal and Torres Strait Islander. So having to supplement that and enhance that data through existing records as well is quite a challenge. So yes, there are different processes and different requirements of different data sets, but if we're speaking about wanting to count people proactively, we need to make sure that those business entities are also included within the discussions of including Aboriginal and Torres Strait Islander identifiers within their data.
Really interesting.
Yeah,
thank you. Something I hadn't thought of at all. We have two more questions in the Q&A. The first one is, again, about data sets. Data sets are only as useful as the data recorded in them. How might we better ensure accurate recording of Indigenous identity in data systems and get approvals to then analyse the data with identity?
Yeah, so the first part of that question is going back to the ask the question. So within health services, within systems, within hospitals, whatever it might be, ask, are you an Aboriginal and Torres Strait Islander person? Are you, yeah, the question's there. And then the second part to that, I don't think it's as simple as saying, how do we use that data? It's about recognising that there are community priorities around, I guess, the direction of research and as a starting point. So if you kind of imagine this as a, you know, if you're thinking about it at a jurisdictional level, you've got Aboriginal and Torres Strait Islander communities that are going to be interested in driving their own research directions, I guess. And so that means working with Aboriginal and Torres Strait Islander communities. It's not as simple as going, oh, well, I just want to use that for this. It's, yeah, community-based. You've then got research groups that include Aboriginal and Torres Strait Islander people. You've also got overarching national priorities as well. So there are quite a few things to consider with the use of data. It's not just about going, oh, right, I'm really interested in figuring that out. And it's not that it can't be pitched either, but it needs to be done so in alignment with, you know, those relationships. So going back to community, going back to Aboriginal and Torres Strait Islander organisations or research groups that are working within those sectors and going, what do you think of this? As opposed to going, I'm going to take ownership of this and I think that this is the right thing for Aboriginal and Torres Strait Islander people. Sure. So yeah. I hope that you can see the difference there between those two mindsets. Yeah.
Yep, absolutely. No, thank you. That's very clear, and I think that would be really helpful for the people who've asked the question. Finally, one last question. Again, now this is about building trust. How would you suggest we as in health services researchers, go about building trust in identifying within systems? So in identifying Aboriginal and Torres Strait Islander peoples within systems.
The starting point is just building relationships. You know, this is about ensuring your own integrity within structures and systems, making sure that that is being met. It's about, I don't want to say the word enabling, but it's hard within Western constructs because that's kind of all that you can do. It is about enabling, I guess, those structures to work for Aboriginal and Torres Strait Islander people, and, you know, making sure that those systems are in place. You speak about trust, and that's what it is. It's making space. It's not saying, and it's not making space in terms of allowing it for, I guess, non-Indigenous worldviews in that. It's about having Aboriginal and Torres Strait Islander values, understandings, systems, ways of doing, process, all of those things embedded within that. And that's a really hard thing to do, I recognise that, but it's also really simple if there's space for it to occur. And so in regards to trust takes time. And it's something that, you know, like my partners that I've worked with many of them for 20 plus years. You know, they've watched me grow up. They trust in my decisions, the way that I do my work, and I trust in theirs as well. And so this isn't something that can even occur in 1, 2, 5 years, which is kind of shitty considering the whole funding round stuff. You know,
long game.
It is, and so it's not about people kind of poking their head in for Aboriginal and Torres Strait Islander research. It's about recognising that any Aboriginal and Torres Strait Islander person working in this space goes home with it every single day. This is something that we eat, sleep, breathe, bleed to, like it's everything. And we just, there is not a moment where we walk away from it. And so, you know, recognising that non-Indigenous people can do that, you know, there's a huge trust in those researchers who have spent their time and space as non-Indigenous peoples walking through Indigenous spaces with the support of Aboriginal and Torres Strait Islander people. And it's not to say that you don't do other things as well, but it's not just popping your head in and popping it back out again.
Sure.
So that's the sort of thing that works with us. Like I said, I've worked with my people for 20 plus years.
Yeah. Terrific. Okay, well, we're nearing the end of our time, sadly. This is a really interesting topic, and there's many more, you know, aspects to cover, but we'll have to do that at another time. Thanks very much, Kalinda. It's been a terrific webinar, and I've certainly learnt a lot from it, and I'm sure many of our members have as well. So the webinar has been recorded and will be available on the Hazran's website. Just to bring to people's attention that the Health Services Research Conference is on in December in Sydney. Abstracts have actually closed. They closed last night. But if you haven't submitted an abstract and you would like to attend and meet high quality researchers, network with policymakers and others doing health services and health systems research, then please do come along and register. It's a terrific event. So with that, thanks very much, everybody, and have a great day.